Did you know that regularly consuming certain nuts could raise your risk of heart disease by up to 48%, especially if you're over the age of 60? That's not a random number. It's based on a multi-year, peer-reviewed study published in the Journal of the American College of Cardiology. And what's more disturbing? Many older adults unknowingly reach for these very nuts, believing they're making heart-healthy choices. In reality, some of these popular snack nuts could silently raise your blood pressure, increase inflammation, clog your arteries, and even worsen cognitive decline. One particular nut, frequently recommended in low-carb diets, has been linked to elevated levels of a toxic compound that can accumulate in your liver, kidneys, and brain over time. And chances are, it's sitting in your kitchen cabinet right now. But don't worry, this video will walk you through everything you need to know. You'll learn which nuts can boost heart health, strengthen bones, sharpen your memory, and support thyroid function, and which ones may be silently undermining your well-being. Stick with us until the end, because the number one nut to avoid has a hidden danger almost no one talks about, and it could be sabotaging your health without you realizing it. Before we dive in, let us know in the comments where you're watching from, and if you're passionate about staying healthy as you age, hit that like button and subscribe to our channel for more evidence-based health tips. Now, let's begin with the top 4 nuts seniors should add to their diets, followed by 4 you should consider cutting out immediately. 4. Best nuts for seniors. 4. Almonds. For bone strength and brain protection, almonds are one of the best foods older adults can add to their daily routine, especially for bone health. A mere 1/4 cup of almonds provides around 97 milligrams of calcium, which helps counteract the natural loss of bone density that accelerates after age 65. But that's not all. Almonds also deliver magnesium, a mineral that plays a key role in transporting calcium into bones and keeping it out of your arteries, where it could otherwise contribute to plaque buildup. Their monounsaturated fats help lower LDL, bad cholesterol, which becomes increasingly important as cardiovascular risk rises with age. Plus, each serving contains about 3.5 grams of fiber, helping to relieve constipation, a common issue affecting nearly 40% of older adults. Almonds are also rich in antioxidants, particularly when eaten with the skin. According to researchers at Tufts University, the flavonoids in almond skins work synergistically with vitamin E to protect brain cells from oxidative damage. Tip: eat 15 to 20 raw or dry roasted almonds daily, preferably unsalted. Be sure to chew them thoroughly to reduce choking risk, especially for those with swallowing difficulties. 103. Walnuts. For brain function and better sleep. Walnuts are often called brain food, and with good reason. Their unique shape mirrors the brain, and their nutrition directly supports it. Walnuts contain the highest amount of alpha-linolenic acid, ALA, among common nuts, a plant-based omega-3 that strengthens brain cell membranes and improves signal transmission. In a study published in the Journal of Nutrition, seniors who consumed 1.5 ounces of walnuts daily for 8 weeks showed improved cognitive processing speed and mental flexibility. These nuts also contain polyphenols that cross the blood-brain barrier and reduce inflammation in neural tissue, potentially slowing the progression of Alzheimer's and dementia. They're also one of the few food-based sources of melatonin, a hormone that supports restful sleep, a major issue for older adults. Walnuts also benefit cardiovascular health through their content of arginine and polyphenols, both of which support blood vessel flexibility and reduce oxidative stress. Tip: eat 7 to 9 walnut halves per day, preferably fresh and refrigerated. Shelling them yourself adds a simple fine motor activity beneficial for hand strength. 2. Pistachios. For blood pressure and eye health. Pistachios may be underrated, but they offer impressive health benefits, especially for regulating blood pressure. With 285 milligrams of potassium per serving and very low sodium, they help balance fluid retention and may lower systolic blood pressure by 3 to 5 points. Similar to the effect of mild medications, these vibrant green nuts also contain lutein and zeaxanthin, 2 carotenoids that support macular health, protecting against age-related vision loss. Pistachios are softer on teeth than other nuts, making them ideal for those with dental concerns. Shelling them not only promotes mindful eating, but also helps prevent overconsumption, a helpful strategy for weight control. A study in the International Journal of Obesity found that visible shells act as a visual cue to stop eating, especially useful for seniors managing portion sizes. Tip: enjoy about 49 pistachios, 1 ounce, daily. Choose unsalted or lightly salted varieties and look for partially open shells if arthritis makes shelling difficult. 1. Brazil nuts. For thyroid and nerve health, Brazil nuts are small but mighty. Just one nut contains 137% of your daily selenium needs. Selenium is crucial for converting thyroid hormone into its active form, making it vital for energy, mood, and metabolism, especially since thyroid disorders affect nearly 1 in 5 seniors, often without diagnosis. These nuts also help maintain myelin, the protective sheath around nerves, which declines with age. Their organically bound selenium is better absorbed than in supplement form. But moderation is key. Too much selenium can be harmful, so it's best to limit intake to 1-2 Brazil nuts per day. Their rich flavor makes this easy to do while still gaining powerful health benefits. Tip: choose nuts still in their shells for longer freshness, and store them in the fridge to prevent rancidity. Brazil nuts also support bowel regularity thanks to their fiber and natural oils. 4 nuts seniors should avoid or limit. 4. Peanuts, a hidden inflammatory risk. Peanuts may be popular, but they're not actually nuts. They're legumes. Grown underground, they're highly susceptible to aflatoxins, toxic molds that can harm the liver and increase cancer risk, especially as the body's detoxification capacity declines with age. Peanuts also contain proteins that can trigger low-grade inflammation even in non-allergic individuals, potentially worsening joint pain, heart strain, and brain fog. High in omega-6 fatty acids, peanuts further fuel inflammation. For those on blood thinners like warfarin, their vitamin K content may interfere with medication. Store-bought peanut butter often contains hydrogenated oils, excess salt, and sugar, compounding cardiovascular risk. Tip: if you love peanut butter, consider switching to almond butter or rotating in anti-inflammatory nuts like walnuts at least 3 days a week. The cashews, hidden sugar spikes, and choking risks. Cashews have a smooth, creamy texture, but they also contain 9 grams of carbs per ounce with a high glycemic index. That's bad news for the 25% of seniors with diabetes and the additional 48% with prediabetes. They're also high in oxalates, which interfere with calcium absorption and can contribute to kidney stones, a growing concern after age 60. Seniors with difficulty swallowing should be especially cautious, as cashews are among the most frequently aspirated nuts. Cashews undergo extensive processing to remove a toxic oil, similar to poison ivy resin, and many commercial brands are roasted in oil and salted, adding unhealthy fats and sodium. Tip: if you're used to snacking on cashews, consider replacing them with walnuts or almonds, which offer better fiber, lower carbs, and fewer risks. 2. Macadamia nuts. Too calorie-dense for aging bodies. Macadamias are delicious, but at 200 calories and 22 grams of fat per ounce, they're the most calorie-dense nut you can eat. That's a major issue for older adults with slowing metabolisms and gallbladder concerns. They also have the highest saturated fat content among nuts, raising LDL cholesterol levels. Hard and dense, they pose dental risks for anyone with crowns or fragile teeth. Most macadamias are expensive, which tempts many to buy lower quality, poorly stored varieties that may be rancid. Commercial products are often salted and oil roasted, making matters worse. Tip: switch to pistachios or almonds for a satisfying crunch with a better nutritional profile and fewer complications. 1. Pine nuts. A surprising danger for seniors, pine nuts may look innocent, but they pose serious issues for older adults. They can interact with over 60% of commonly prescribed medications, including blood pressure drugs, statins, and antidepressants. Yet many doctors fail to mention these food-drug interactions. Worse, pine nuts can cause pine mouth syndrome, a lingering bitter metallic taste that lasts for weeks. This often leads to appetite loss and malnutrition, with research showing that up to 42% of affected seniors experience significant weight loss. They also contain unstable fats that oxidize quickly, promoting inflammation, problematic for seniors with arthritis and chronic conditions. Tip: avoid pine nuts altogether, especially if you're on medications or experiencing taste changes. Opt for safer alternatives like almonds or pistachios. Conclusion and call to action. So, there you have it. 4 nuts that can dramatically support your health as you age, and 4 you may want to limit or eliminate from your diet starting today. Which nut surprised you the most? Let us know in the comments below. And if you found this video helpful, don't forget to like, share, and subscribe for more science-based health insights tailored to your needs. Thanks for watching.